My name is Dr. Bolorunduro. I am an interventional cardiologist at Nova Cardiovascular Care. A heart attack is otherwise called a myocardial infarction. It's of two types. An ST elevation myocardial infarction, which is the sudden type that has 100% blockage in one of your arteries, or a non-ST elevation myocardial infarction, which is also sudden but is not as acute in terms of how quickly we need to fix it. But basically it means your heart is not able to get enough blood to a certain section of the heart, and it's an emergency. The most common warning sign of a heart attack is chest pain. You could have chest discomfort. Sometimes people feel like they have nausea, they feel like they want to throw up. Some people even have belching. You could have shortness of breath. You may have reflux. There are many risk factors for having a heart attack. If you've had somebody in your family have a heart attack before, that's a definite risk factor. As you get older, age is a risk factor. Gender, being male is more of a risk factor. Smoking is a strong risk factor. Diabetes, having high cholesterol, and having a high stress environment. Recovery for people who come in quickly is quick. I've had patients who come in and they have a bad heart attack, and then we go in and we open up their arteries. They feel great immediately afterwards. We keep you in the hospital, monitor you, and then in the next day or two, they go home. If you think you're having a heart attack, it's an emergency. If you've had a heart attack before, you definitely want to consider any other symptom that looks like that urgent. You want to call the emergency medical services. This is really not the time to drive to the hospital or to have a family member drive you to the hospital, because we don't want you driving and something bad happens and now you get into an accident, or someone else is driving you and then you have an emergency and you need CPR. If you think that you need to learn more about a heart attack, you could visit the Centera Heart and Vascular Center. Website is centera.com/heart-center.